Well, very good to see you all this afternoon. I'm sorry I was missing this morning. I was challenging government ministers about sustainability and transformation plans and making sure that mental health is central to those plans, because there's a lot of concern that is not the case across the country. And although he's gone, I should thank... Oh, he's there! No, right. So Jeremy, I was going to thank you rather than slag you off. So, first of all, for coming here, because he needn't have come here, and I think that's quite an important signal for us of his intent, and the fact that he has taken personal responsibility for this agenda. I think is actually incredibly important. I've talked to him about the fact that he's having weekly meetings now focusing on mental health. And for the Secretary of State to apply that focus to an area of policy actually has an impact. It sends ripples through the whole system. And so I think we should be very grateful for that. And it's also fair to say that when I was Minister responsible for this priority area, fronting up the work that Emily was doing, of course, Jeremy helped me at key moments to get things over the line, to make things actually happen, particularly when I think of the access standard for early intervention in psychosis. So thank you, Jeremy. It's appreciated. And I also wanted to thank the Education Policy Institute for deciding to focus on this area. Incredibly important that a think tank chooses to do this. Thanks also to the commissioners. I have to say that when I was calling this whole range of eminent, powerful, effective, articulate people, I didn't think for 1 minute about how impossible it would be to chair meetings with them all. But they were amazing, and they contributed an enormous amount to our work. Young people who played their part as well, thank you, because you helped shape our recommendations. But I also particularly wanted to thank Emily for amazing work. Emily worked with me in the Department of Health, so it's been great to recreate this working arrangement. But she's done brilliant work on this commission, and she should be thanked for it. Thank you for leading the applause, Charlie. And I should also mention Mark Chentite. Is that the right pronunciation? Sean Teat, my goodness, how embarrassing. But Mark is from Mac UK. And as I understand, it was one of the lads that Charlie first met on the street as she took her therapy out of the clinics and onto the street. And the journey that he's gone on has been an inspiration to everyone and demonstrates the power of the approach that Charlie and Mac UK takes. So if you can pass on our thanks to Mark for his contribution, it's immensely powerful. So I just wanted to also start by saying something about my journey on this particular issue, because obviously we had our own background as a family, and we had been let down by the NHS. This is the truth of it. We were told, and I remember hearing Jeremy mention a while ago about waiting 6 months. Well, that's what we were told as a family. We would have to wait at a moment in time when we were desperate. And there was no possible way we could contemplate waiting that long. So what did we do? We paid for care for our son. But I can't begin to tolerate a country where those who have access to resources can get help and treatment at the moment of need, and everyone else who doesn't have the money is left waiting. That, for me, is an intolerable situation, but it is what pertains in this country. And incidentally, this country is not alone. And it means that there is an enormous moral imperative, but also economic imperative to change this. And as Minister, I became increasingly horrified by what I saw of children's mental health services. I saw so often brilliant people working in a system that simply failed to enable them to have a maximum impact on the children that they were trying to care for. A system that was too often completely dysfunctional, that has totally perverse incentives, that actually incentivises a shift towards the acute end of the spectrum rather than preventing ill health and preventing a deterioration of health. And that is why I therefore decided to set up the task force that led to Future in Mind, which was published in March last year. And I would say, Jeremy, I think Future in Mind provides the perfect blueprint for the sort of shift of emphasis that is needed. We don't actually need to reinvent the wheel. It's had enormous input from academia, from people practicing in the field, from educationalists. And it just now needs, in a sense, to be implemented. It needs to happen. So in setting up this commission, we wanted to look at what has happened since Future in Mind. We wanted to look at the progress since all those transformation plans were implemented. But what we found is, to be honest, still quite disturbing, very disturbing, because in so many places there are high thresholds, which means that you have to be really sick before you can get any care. How can it possibly be right that a teenage girl, for example, with an eating disorder, referred by her GP for treatment, is told that her BMI isn't low enough? It's like saying to her, go away and get sicker, and then we might give you some treatment. It completely cuts against all the principles of early intervention that we now accept. And waiting times across the country, too often horribly variable, and waiting 10 months as a maximum period for waiting in many areas, it seems to me, is completely intolerable. And the impact on families is dire. So many families let down by the system, and we cannot tolerate this any longer. So we analysed the transformation plans, and it's right to say that there are some areas that are doing great work, that are actually shifting resources, as Jeremy said, into prevention. I went to Oxfordshire, where every school, every secondary school now has a mental health worker going in every week to work with the teachers. And I'm conscious that in other areas they have shifted resources supporting third sector organisations, which are often brilliant at supporting youngsters at a much earlier stage. Dan Mobbs from the Mancroft Advice Project in Norwich is an example of that sort of approach. But in too many areas, there is still a lot of work to be done. In all but 15%, we found that the plans either required improvement or substantial improvement, and that, frankly, isn't good enough. In terms of barriers, recruitment is clearly an issue. 83% of areas that responded to Emily's FOI said that they had problems recruiting, nurses being the particular problem, but also psychiatrists. Funding, clearly an issue. In the first year, 143 million, not 250 million. And we have to surely make sure that that money is spent where it's intended. And only 0.7% of the total NHS budget is spent on children's mental health. Does that make any sense at all? Given that we know that 80% of, or 75% of adult mental health starts before the age of 18. So in terms of the key recommendations, let me just summarise one or two before we hand over to the panel. The main one, and I really would urge Jeremy and his colleagues to think about this. In the last Parliament, the former Prime Minister decided to focus on dementia as his key priority, giving central prime ministerial focus to dementia. We believe that the same level of focus needs to now be given to children's mental health. And it would send such a powerful signal if the Prime Minister carried forward her commitment, her statement about the burning injustice of the way in which people with mental ill health are treated, by saying, this will be my prime ministerial challenge, to transform, to revolutionise the way in which we support children with mental ill health and, critically, prevent it in the first place. So that is our central recommendation. And there should be three elements of it: a central focus on prevention, a focus on early intervention, and a focus on delivering better treatment. Thank you and goodbye. Within that, let me just identify one or two key points. First of all, we want to see a mental health research institute established, because we are still, at the end of the day, at the start of a journey of our understanding of mental health. There is so much more we could achieve if we understand it better. In terms of early intervention, we want nationally kite-marked, easy access services in every area. The WIACs, the sort of thing that MAP does in Norwich, should be available everywhere, often provided by third sector organisations. And then focus a national government programme to focus on schools, because this is so critical to the achievement of better use of the resources that are available to us. A trained lead for mental health in every school. Ofsted focusing on well-being in the way in which they carry out their inspections, so that ratings actually reflect how well schools are doing on this. Training of teachers and mandatory high-quality PSHE with dedicated time for mental health and well-being. And then finally, in terms of delivering better care, this money that was allocated, identified in the budget last year, £1.25 billion for mental health for children. And yet in the first year, this shortfall. And now, in the second year, it is just part of the general allocation to clinical commissioning groups around the country. And transparency, as Jeremy said, will make a difference, but it doesn't guarantee that it will be spent as it should be spent. And it doesn't guarantee that it won't just offset other cuts, perhaps from the local authority. So we believe that every year the new allocation of money should be tied to areas demonstrating that they have followed through on their commitments, that they are maintaining the momentum to shift resources to prevention, and that they have an absolute cast iron guarantee that the money will be spent as intended and that it will not offset cuts elsewhere. And unless we get that, we will fall short. And then finally, we need to end the awful cliff edge that so often applies at the age of 18. There are so many horror stories that I've told, youngsters who have been told that their treatment will be delayed for a few months until their 18th birthday, for goodness sake. This sort of approach to children's mental health has to change. It should be based on the needs of the child, on the individual, rather than based on the needs of a system. So look, we have the foundation stones in place with a blueprint, future in mind, that could, if it is implemented, transform children's mental health support in this country. We have an allocation of money from last year that, if spent as intended and if focused on preventing ill health, could make a massive difference to families' lives across the country. But with an NHS under such impossible pressure at the moment, my fear is that we will miss this historic opportunity. So that's why a Prime Minister's challenge on children's mental health is absolutely imperative. Thank you very much indeed.